Hey, it's Jessica DaMassa with WTF Health. I'm here at Giant Health, and joining me right now I have Joe Elborn. He is the president of the European Health Parliament. So welcome, Joe. It's good to talk to you.
Thank you.
All right, so tell me a little bit about the European Health Parliament. What is it? What do you guys do?
So we're a movement across Europe, and at any given time there's maybe 200 young people who are working in either national context or European context very closely with policymakers and institutions and stakeholders to come up with a view after a period of about 6 to 12 months of what the young people in Europe want from healthcare in the future.
Okay, so a million questions after this. Well, how are you defining young people? What's young?
Below the age of 40.
Oh, hey, that's good. I'm sure a lot of our viewers are going to be excited about that. All right, and so what are the things that matter to young people about the health system in Europe?
So obviously there's a big digital piece. What does this transformational wave of digital look like? What does it mean for Europe? Obviously there's a lot of really seductive fixes for healthcare systems which are by and large moving closer and closer towards crisis as there's a massive new demand. So obviously chronic disease, older people, more people, and not enough resourcing to deal with any of that, frankly, in any of the healthcare systems across Europe. So that's the big challenge, as it were.
Is the sentiment among the young people, are they excited about the digital transformation of healthcare? Are they like curious about it, cautious, worried, unhappy? Like, what's the prevailing sentiment?
It's a mixture. So obviously there's a lot of excitement. So you look at Babylon and an AI doctor who's deployed right the way across Rwanda, and like that's incredible stuff. But I think there's also a healthy dose of skepticism because we're now seeing the flip side of what technology can do. So we've frankly destroyed our democracies by Facebook and Twitters, and that's led to Trump and all that kind of awful stuff. And we are more cautious on some things and very excited about others, and how that's going to play out, we'll see.
What do you think people are more cautious about? Are they is it like a data privacy issue? Are there certain health conditions that are off limits? What is kind of the prevailing thinking there?
So my view would be that the data privacy stuff is a bit overblown.
Oh, is it? Okay.
I think there's a generational divide where I think the sort of slightly older generations are quite protective over their data.
Yeah.
And the younger generations, the Facebook generations, are pretty open about it. Like, it's all out there anyway. If you've got a Tesco club card or a club card for anything, they know anything about anything. So there's
in the States, it's Amazon. They know everything.
They know everything anyway. So like, hiding stuff from them doesn't really make any sense. And obviously we've had the big GDPR thing come through from the Europe, and that's the spirit of that is right. It's a bit complicated. It's a bit heavy, and there's lots of unknowns about it, but. I don't think the young people are per se particularly worried about the data privacy piece. I think they're much more worried about monopoly capture of spaces.
Okay.
So I'd be much more worried about, let's keep with the example of Babylon. So Babylon, run by really nice people. They seem to be doing the right thing in the right way for the right reasons. Mm-hmm. But what if your frontline GP was owned by a huge pharmaceutical company? What if that pharmaceutical company ran it for a whole country, and that was like your first point of contact with the healthcare system, and they need to recommend you a drug? Well, surely there'd be a temptation there to say, well, actually, why don't I recommend my drug rather than the other person's drug? And then we start getting into really tricky stuff. And then what if it was a malign government which owned that frontline healthcare? Maybe China develops an amazing app which just beats doctors all the time in terms of diagnosis. What are they doing with? What would they be doing, and how would that give them power in a system? So I think that there is. I think my impression, obviously, I'm one person speaking for mainly myself, but that I'm much more scared about that monopoly, massive capture of a space than I am about data privacy.
What are the young people who are involved in the European Health Parliament, what are they excited about when it comes to this? Like, is it the digital stuff, or is it more like, I don't know, more of the exciting like scientific breakthroughs in medicine or healthcare? Like, what are they excited about?
Pretty much all of it. So, being there's, as I said, about 200 of us every given year. In the European edition, there's maybe 60 or so people, and they're all just massively passionate, amazingly smart, wonderful human beings. So of course they're excited about a lot of stuff.
What bubbles up though? Is like a topic over and over again. Is there anything like that?
So the key kind of topics I think is this concept of trust keeps coming up.
Okay.
How do we engender trust in the system? So we did a big lot of stuff on vaccination last year, which I'm really proud of. And I'm now the front page of an anti-vaxxer website, and they claim I'm an evil stooge of industry, which I'm really, really proud about. So it means
we'll list that underneath as your title, evil stooge of industry. That's awesome.
So like that means I'm doing something right. So
Apparently
I'm pretty happy about that. But we also see that with AMR as well, where there's a really important behaviour change that we need. So I think there's a lot of conversations about how do we regain this trust, which has frankly been lost a lot in systems more generally, but in healthcare specifically. People just don't believe their doctors anymore. They believe some right-wing lunatic who says vaccination causes autism, which is demonstrably not true,
right.
and causes death, pain, and awfulness if we don't do these things.
So I was going to ask you too, like about concerns as far as like beyond trust. I mean, which I think is like a big, broad theme. I'm curious if the young people are at all concerned about caring for the old people. So like if there's any kind of that, like, I mean, we have a population of baby boomers worldwide that are going to be aging, and these are the parents of these people who are young, right? So it's like, is there any concern at all there about caretaking?
Totally. So last year we did some stuff on robotics. So one of the neat solutions is we just the elderly care will all be done by robots.
It's like we don't have to deal with our parents. We'll just send a robot. This is how we're going to fix it.
That sounds like the right answer.
Yeah, this is totally like a millennial idea.
So that's like yes, of course it's a question. It's probably not something we've deep dived into.
No, I'm just curious. Yeah.
But it is obviously a looming thing.
So how do you think healthcare, if this younger population of 200 that are working with you have their say so, how do you think healthcare is going to look different in the future? And I'm curious both about the short term and the long term. So a couple years from now, 2-3 years out, how do you think healthcare is going to look different?
So 2-3 years out, yes. I was going to say there won't be any hospitals anymore, but that's a bit more than 2 or 3 years.
Oh, no, we'll get to that. Save that answer.
So
2 to 3 years first.
2 to 3 years time. I think there needs to be a fundamental shift from process to patient.
Okay.
And I think that shift is going to be driven by value-based healthcare, which is possibly a concept which has come up, driven a little bit by America from Harvard and Michael Porter. It needs to be reconfigured and tuned for what European health systems look like. But I think that's the answer, is to work out what are the outcomes that matter to patients and how do we get them those outcomes, and then put your money there. And that means a lot more energy put into mental health. That means a lot more energy put into prevention. That means probably a lot more energy put into digital. I think that's a fundamental change, which is the wave is growing, but it's not there yet. We're starting to see value-based procurement starting to happen, and the payer and reimbursement community really looking at this a bit more seriously, but we've got a long way to go. But I think in the next 3 years that'll be the big change, the big system change in healthcare in Europe.
And then 10 years, no more hospitals? Is that what you're saying?
Maybe 15.
Okay. No more hospitals, and why is that?
No more hospitals. Well, I just think it's if you look at the way hospitals are a very weird kind of place almost. I mean, the genesis of them has been they basically just look like what the universities look like, and that's so they're sort of built not with patients in mind, but with the doctors in mind. And I don't think that's a particularly reasonable thing to continue anymore. So there's some really amazing clinics like the Mayo Clinic who have totally rebuilt their hospital setup. So instead of having to go to get your eyes in that building checked and then your brain in that building checked, what they've done is they said, well, that's just like head stuff. and they found loads of really amazing synergies, which have happened when the eye people sit beside the brain people. They're like, oh, well, actually I'm working on something which actually is really relevant to you. So that makes a lot of sense from a hospital point of view. But getting rid of hospitals altogether is hopefully the right way to go, because we're seeing this transition from the hospital setting to the personal setting, home care. Diabetes is a great example of a disease area where self-care is now becoming the norm. Why would I get in a car and drive 1 hour and then wait in a long waiting room when I just need a 5-minute Skype with my doctor? Why do we not have 500 doctors on Skype? That seems like a much more efficient, number one, and much more painless from an emotional point of view for patients. Point two. So I think we're going to see that as a big new shift right the way across Europe.
All right, cool. Well, thank you so much for sharing your perspective with us and also speaking for this group of 200 that you have there at the European Health Parliament. Very nice to talk with you, Joe. What was it? Evil corporate stooge? Is that what we're calling you now?
That's my aim.
I got it. I love it.
Life
goals. We should hashtag that. Joe, it's a pleasure talking to you. I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.